So good evening, ladies and gentlemen. I am representing Marshal Engineering, the product called anti-fatigue mat. Quickly, I'll go through my introduction. Myself, Dr. Jayesh Dhake. I'm an orthopedic and joint replacement surgeon working as a head of department in Shri Rugnalya, Nashik. It's an NGO, which is another branch of Headgear Hospital from Sambhajinagar. Now today we are working as a 100-bedded hospital approximately, and within a year or two, we'll be going to 300-bedded hospital under the guidance of HOSMAC, who are the already giants of making hospitals. So to be very quick, let's be little bit of interactive, and I'll be talking about the mat. But before that, why this mat is being used? I'd like to ask, everyone has a single heart, or we have another heart? Do we have a second heart? Everyone knows, all maybe a few people are from medical backgrounds. Do we have a second heart? No? Yes? No? Yes, somebody has answered calf. Of course, it's called the second heart of the body. Okay, so we have two calves, two legs, so two calves, two hearts. Okay, so one, of course, everyone knows the significance of the heart, but the second heart is the calf. The calf is the most important reservoir of the blood also. Okay, some of the veins, they may store the blood. When there is a emergency, we go for a peripheral thing, because calf is the peripheral part of the body and the hands are the peripheral parts of the body. So why calf is called the second heart? Because it consists of lot of blood vessels and veins, which pumps the deoxygenated blood to the heart and get oxygenated, and again it is vice versa, going circulation through our body. So calf consists of two muscles, gastrocnemius and soleus. So they both form the tendon called Achilles. It is one of the strongest tendon of the body. Friends, you must have heard the story of Achilles. Anyone knows Achilles? The picture movie we saw, the movie Troy. The name was Achilles. And he was immortal. Why he was immortal? Because nobody was, he will be, never ever be killed. But only because of Achilles tendon, he was not able to move. When he got shot by the arrow, there was a break in his Achilles tendon and he was not able to run or walk. Same way, our military people are been trained. They have been brutally trained to cut this such type of Achilles tendon, which is the most important and strongest part of the tendon, from where the criminals or the terrorists cannot run. And same applies to us. So it is one of the most important tendon and strongest tendon of the body, and it is the extension of the calf. So it's the second heart of the body. So in this mat, specifically to tell you why this has been used in such type of long-standing cases, because the calf, if it gets fatigued, the pumping will be less. And if one of the conferences I have gone through, somebody spoke regarding the footwear. If you see the footwear, everyone are wearing the leather shoes and all these things, but when you remove the shoes, you feel, so nice, so better feeling. Somebody must be pressing your hands, okay, palms. Somebody maybe, if you tell someone to press your foot, you feel better. Why? Because they are the pressure points and the periphery of the body, which has abundant nerve supply, abundant blood supply. So that's why there is a lot of fatigueness if that doesn't go in circulation in a regular manner. So friends, I'd like to tell you regarding the mat. AV, can we have the PPT? Okay. So I am representing Marshal Engineering. So to quickly go, Marshal 11 is the mat name. And it is Stand Comfort with Marshal 11 anti-fatigue medical mats. It is an antimicrobial silicone rubber proven to prevent the growth of bacterial strains such as Salmonella, E. coli and MRSA, which is most important and resistant organism which may be found in our ORs or operation theaters. Silver iron technology. You must have heard the ointments, some of the ointments have silver for the wound thing. So silver iron technology is at the core of Marshal 11, which inhibits the growth of bacterial cells by disabling the proton pumps and interfering with sulfonyl proteins. This process disturbs cell wall synthesis and therefore bacterial functioning. It is commonly used in medical, pharma and food manufacturing. So we have discussed regarding the calf, known as second heart of the body. Muscles are gastrocnemius and soleus. It works in coordination with heart to circulate the blood in the body. They pump the deoxygenated blood to the heart against gravity. That's balanced circulation. That's against gravity, please make sure. And it acts as a reservoir or storage of blood. Whenever there is a heart pumping activity is less, these calf muscles are the reservoir. If you give ankle pumps to the patient, some of the blood circulation may get revived. So that is the calf veins which store the blood, and that body does not need to circulate at that particular moment. So that is acts as a storage. And the reason why it's a second heart of the body, because there some of the blood is stored over that in the calf veins. They also support the walls present in the veins which keep the blood flowing in the right direction. So everyone must have heard regarding the varicose veins. So varicose veins have a ball valve mechanism. To give an example, it's a water tank. If the water tank gets full, there is a ball valve mechanism. The water should not overflow and the ball gets stuck in between. So same, we have some valves in the calf. If that ball valve mechanism is disturbed, so you will have varicosities. So in what conditions we can use this medical mat? So there will be muscle strains due to overuse or misuse of muscles, which will give rise to pain, stiffness, weakness, limited range of movements. Muscle cramps, holding a position for too long. So muscle cramps may be due to dehydration also, overwork, overuse, low electrolytes. Simple medicine is water, which we don't have in a regular basis. So that's a simple which maintains the calf dehydration. Then other is muscle tiredness, deep vein thrombosis. These are the preventive measures where we can use this medical mat. Achilles heels, what we said. Plantar fasciitis is another, varicose veins, neuropathies, peripheral vascular disorders, and compartment syndrome. So remedy is Marshal 11, an ideal solution to all above conditions, a soft solution for hard times. Excellent relaxant for surgeon in long-standing surgeries. As I being a surgeon, I am representing this mat because I have been using this mat since 2 months. So it's like trial and error I myself have done, and I have agreed to represent this mat because we have been, I being an orthopedic surgeon, sometimes some of my surgeries will extend till 3 to 4 hours also. In fact, some of our neurosurgeons have also started using the mat in our own hospital. So can be used in workers in pharmaceutical packing lines, medical labs, neuropathic assistants, patient with hip and knee joint replacements where they need calf exercises or calf pumps. So I'll not go in detail because I am not the master of this mechanical properties. I'll just go through it. So these are the mechanical properties: hardness, tensile, elongation, tear strength, and compression, which has undergone this mat. Characteristics which: brittle point, limited oxygen index, thermal conductivity, and radiation resistance. The benefits what this mat has: it can resist the temperature up to, or it can maintain the temperature up to -60 to 230 degrees centigrade. Environmental resistance, ozone, UV, and weather resistance. So it is resistant to this environmental part. And flame retardant FR25/JR25. And long life service versus other elastomers. So these are the aggradations which have got this mat for this mat, and as well as the Marshal Engineering, FDA approved, JISZ 20601/2000 test for antimicrobial activity, and flame test for aerospace application. So these are the other certificates which have been certificate of registration and conformity. Thank you. I would like to call upon the CEO of Marshal Engineering Corporation. He has a small story to tell you. Mr. Surendra Singh Kalsi, please, I would like to welcome you. He is the CEO of Marshal Engineering. By profession, he is a mechanical engineer, and to tell you, and to very proudly tell you, he is an ex-army person serving the nation. So please welcome Mr. Surendra Singh Kalsi, and he'll have a small story to tell you, and in fact, any of the technical questions, he's there to answer you. Thank you.
Hello. Jai Hind, ladies and gentlemen, a very good evening. Marshal, our company, we make a niche equipment for oil, gas and power sector in the engineering field. But in 2017, I was detected with tongue cancer. And the operation or the surgery took more than 11 hours. This is what my daughter told me. Since we make anti-fatigue mats for the industrial sector, I thought that why not the surgeons? They are second line of soldiers for humanity. So I thought of making anti-fatigue mat for the surgeons, but a lot of things came in the way that since it is used in OT, it has to be antibacterial. So silicone rubber is antibacterial, but then to enhance it, we used silver ion technology, that is silver metal is introduced into the top layers. And then we had gel to make it anti-fatigue in nature, but later on we converted it into a semi-solid. So this is how this came into existence. And this is the first time that Marshal has stepped into healthcare. And we are just trying to promote this and sort of making the surgeons aware that such a product exists in India. It is a totally made in India product, and for the first time in India. So I would request everyone to just go through this and use it for as much as possible for all the surgeons and the rest of the people who can benefit from it. Thank you.
Thank you so much. Can we have a huge round of applause for them, everyone? Requesting you to please come here. Going ahead, I would request Rahul Sequeira to please come here and join us for the felicitations. Requesting you to please take the center of the stage. Can we have a huge round of applause, everyone?